indeed it's a honor and privilege for me to come here, being invited by Sai, Kishore, and the team. I'm so thankful to you and really appreciate for your effort. Healthcare in the United States is very expensive. We all know that. But even in India, it's considered to be very low. It's rapidly increasing. That's because a lot of investment has come in, technology has come in. Obviously, all the cost has to be passed on to the patient. And when it comes to cancer, it's even worse. Very expensive care. So under these circumstances, we run a large cancer hospital, one of the biggest in the country, and we are not for profit. So I want to share our experience with the Augustus audience in here this morning. This is our hospital. Greetings from Indo-American Cancer Hospital and Research Institute, located in Hyderabad. We are a 650-bedded tertiary care center. We get patients from all the surrounding states in southern India. And it's absolutely not for profit. Something like 50% of patients either don't pay or pay very less. We know the moment you hear about cancer, it's a very frightening everywhere. There are valid reasons for that, because it is sometimes equates to death sooner, around the corner. But not necessarily though. Why it is? Because in cancer what happens, the cells grow uncontrollably. Normally there is a very balanced mechanism. There is a constant turnover in the body. Old cells die, new cells form. In that process is a well-regulated mechanism. Somehow something goes off track, and then these cells uncontrollably multiply, and then once they multiply, they also destroy the local tissues. And the worst thing is this: it spreads to the distant parts. Once it reaches that stage, even if you go and deal with that tumor in the breast, there's nothing you can do. So this is why cancer is really worrying. And cancer is worrying because 1 in 5 develop cancer during their lifetime. So it's a reality, real reality. And 1 in 8 men and 1 in 11 women die of cancer. That's what the World Health Organization says. So it's a substantial problem, especially as populations grow older. It poses a greater problem. The other important factor is that a lot more younger children. We have a very large 90-bedded pediatric oncology unit, and we see children as young as 1 year old developing blood cancer. And someone asks, I follow all the strict regimes, follow everything perfectly, I shouldn't be getting cancer. Then we tell them, look, that child hardly stopped breastfeeding, gets cancer. So it is a reality. We're not going into the causes of cancer here for want of time, but last year there were 20 million new cancers in the world, with breast cancer being the leader. In India, we have a very peculiar situation. If you see that, third of entire oral cancers in India for various reasons. And the same thing more or less with uterine cancers. It's an enormous problem for us. The other factor is that this incidence is going up, especially in the developing nations, for various reasons. Again, it's a very complex subject, why cancer, why it is increasing, etc. But the fact remains, this 20 million will become 25 million in another 10 years' time. So, it's a challenge for the policymakers, healthcare workers, everybody. The reason is, unlike other diseases, cancer care is very expensive. I've got a table in here. If you can take a look on your right side, PET scan, which is the basic requirement of cancer evaluation, cost anything up to $10,000 in this country. Even for average Americans, I'm sure it's a lot expensive. And as you go down the list, you see that a full treatment costs anything up to $500,000 US. Although it's a 10th in India, if you look at that PET scan, $450 or $200 is a month's wages. And how many people can really afford $40,000 equivalent in Indian rupees? Not many. And something like 70% of patients pay out of pocket. Whatever the insurance is just increasing. There are of course some government schemes available, but vast majority of them end up in paying themselves. So this is what happens. It becomes a catastrophic expenditure, and somebody aptly called distress financing. They exhaust all their lifetime savings. Family silver is sold. Many of them borrow money and sell their houses, because cancer is a very emotional thing. If my father has cancer, I'm so emotionally involved, I wouldn't hesitate to sell my only house. And often what happens, the treatment may prolong his life another year or two, but the inevitable comes, and then many times these children were on the road, having sold out all their assets. And one study by Tata Memorial Cancer Center showed that 72% belong to such category, and 15% of them, they tip the balance, being fairly middle class people, running well, and they go below poverty line. That is the kind of burden what we are talking about, cancer. So cancer is the most expensive. The nearest is heart care, which is 50% less. So if the cancer destroys the patient, the treatment destroys the families. That is the problem. It does destroy. And we see many times, and being in the non-profit hospital, many of these patients having spent all their resources elsewhere, and they come to us at the end of the day at a very late stage and in a terrible condition, cannot afford even a basic pain medication. That is the kind of situation. We have a policy not to refuse any patient, no matter how complex it is. That is the kind of fundamental principle and ideology the hospital was built in. We continue to do so. So for that reason, sadly, they opted very emotionally for expensive treatments instead of choosing, low cost. Obviously, you deal with the life, and therefore whatever best that is available, you wanted to choose that. They can't afford, they drop. Many of them do drop in the middle. So whatever that has been put in goes sometimes wasted. Keeping that in mind, having seen our founding father around 30 years ago came up with this idea, I want to share this video which will sum up our
In
hospital.
1989, Padma Shri Swargiya Nandamuri Tharaka Rama Rao, the then Chief Minister, tragically lost his beloved wife, Srimati Basavatarakam Garu, to cancer. Fueled by personal loss and driven by a dream to conquer cancer, he embarked on an extraordinary journey. Under the auspices of the Indo-American Cancer Organization USA, on June 22, 2000, the institute opened its doors, inaugurated by the then Prime Minister of India, Shri Atal Bihari Vajpayee ji. Thanks to the generous contributions of donors who share a vision, our institution has seen significant growth. With a world-class infrastructure of 650 beds and state-of-the-art equipment,
We specially care for the underprivileged cancer patients. This hospital, with the best team of doctors and latest equipment, made us one of the top cancer treating hospitals in the country.
we are proud to be recognized by Niti Aayog as the best not-for-profit trust hospital in India.
These surgical procedures are complicated and complex, which can make these procedures very expensive. Sometimes instrumentation which is imported would need to be used on these patients irrespective of their financial status. Out of about 750 surgical procedures that happen per month in the hospital, 55% of them are done for poor patients who actually do not pay anything to the hospital.
Bone marrow transplant is a very complicated procedure where the patient has to stay in hospital for more than 30 days and which actually incurs a lot of cost. And in our center, more than 25% of the patients are actually getting done free, and the rest of the 75% of the patients are able to do it at the 60% of the cost what usually a transplant requires.
If you have a kid with a cancer that is curable, then this kid needs to be able to access the therapy that is available here at the least cost, or maybe even free of cost, because this kid is likely to be able to get rid of this disease completely and be a useful citizen of this country.
Not only the patient, but cancer affects the family. So here, as a palliative care professionals, we do not just treat a particular issue by giving medications, but the discussion, the ongoing support extends in a multiple fold by psychological counseling, offering spiritual support.
This hospital also has special focus on research and development in the direction of finding new and innovative methods of cancer treatment at very low cost. We visit remote areas with teams of experts and the specialized equipment and find the cancer at a very early stage so that the cancer treatment is more complete and effective.
We equipped with 2 units, one generously donated by the Indo-American Cancer Organization USA and Rotary International, and another by the State Bank of India. Our commitment to providing quality care extends to ensuring that individuals with limited economic means receive the support they need. To address this, we offer free dormitory accommodation for daycare patients and their attendants, along with complimentary meals.
This hospital is the fulfillment of my mother's wishes and my father's determination to help the poor. From common man to international patients, everyone is given the same world-class cancer treatment.
As we meet our patients' needs and witness their smiles, we acknowledge the challenges ahead. But despite our limited resources, our resolve remains unwavering. Serving humanity is a calling, and with more compassionate hands joining us, we can save countless lives from cancer.
Well, ladies and gentlemen, I suppose that kind of model fits with Mr. Rodolphe, what you're talking about, touch a life. We've been touching lives of millions of people over the last 25 years. I'm very happy and proud to say that I am associated with this organization. Over the last 25 years, these are the figures. If you see that something like 4 million outpatients visited us, with almost a million patients being admitted, treated in-house, and so far 356,000 new patients being treated. And the bone marrow transplant, which is a very expensive procedure, we have conducted nearly 550. And last year, if you look at those figures, 23,000 new patients visited us. They are all first-time registrations. And then if you see that almost 300,000 outpatients with inpatients of 88,000, and those are the kind of figures what we are talking about in a single center, which was started as a very meager 60-bedded hospital over the time, in spite of being a complete not-for-profit hospital. In fact, that's one side, it is success, the other side is the burden. And as I said, vast majority or large number of them children. These are some of the survivors who actually completely got rid of the cancer with the treatment. So I'm very proud to show this picture. The main problem challenge being that late presentation. If you see the slide there, in the United States, 70% patients come in stage 1 and 2. It's the other way around in India. 70% come very late. We all know very well if it could be picked up at an early stage, the high curable rate, treatment is less intensive and the survival is better, and of course the cost would be less. But in case if they come late, this is what happens. The treatment is very expensive and then the outcome also very poor. Even in a very highly subsidized rates in India, it costs $30,000. And you can imagine, I'll leave it to your imagination, how much it costs if the patient comes with stage 3, stage 4 cancer. Why we have so many late patients? I mean, sorry to show this ghostly kind of picture. This is not an unusual situation. Because cancer is taboo. Patients put towels around their necks. Woman covers her breast, doesn't even share that news with her husband, because they don't want to show it. So they just let it brew, and then finally they come to us at this kind of stage. Because of lack of awareness, there is no structured screening program in India. Only 5% of women are screened. less than 5%. Some northern states do not have any screening program, and that's what happens. Keeping that in mind, we have this program, the last 20 years running. This bus was donated by Indo-American Foundation. A group of doctors who are well settled in here purchased this bus for us, and it is equipped with mammography, ultrasound, X-ray, and we go to the very remote areas, really remote areas, to their doorstep. We educate them, we pick them up and then examine, and then inside the bus you have all this equipment necessary to diagnose, and it's all completely free. Cases diagnosed come back to our institute, and they go through this free treatment. As I said, if you can pick them up at a very early stage, the treatment is complete, and the burden on hospital is much less. So that is the mission, and it's going on very well. We have a third vehicle joined us recently. Apart from that, we also take the mission to sort of educate the groups, selective groups, and then create awareness. And recently we have even undertaken free vaccination for girls for cervical cancer 9 to 14. We go to slums and we pick up the children there, and we have lots of people supporting us. Companies like Infosys, they just handhold us, and at a highly subsidized rate we get vaccine free. Yes, we do have lots of challenges. These doctors, they are highly expert doctors, and they have super offers outside in the corporate hospitals to retain this talent. And being a tertiary referral center, you have to have a high-end kind of professional expertise. That's what is expected. So that's extremely difficult, but I'm so happy to see that many of these people have a great commitment and this passion for service, and you enjoy that, and that's the kind of people. So we're very fortunate to have. But this is the difficult part, to procure equipment. This is a robotic machine that does robotic surgeries. California buys from the same company. In fact, our price is 50% higher. We end up in all sorts of import taxes. But yet, when you do an operation on this machine, we charge less than 10th, maybe 20th. A robotic surgery costs 1/20th of what it would cost in here. And all the laparoscopic equipment, again, they have to be cutting edge, very latest, same source, but we can't collect from the patient. And like you see, this PET scan costs anything up to $2 million. So is the robotic machine costs more than $2 million. And all have to be, luckily we have so many people coming and holding us hands and then making our life easy. The other problem is on the treatment side. Now we have access to all the best kind of medication in the world. Whatever you get in here, we have access. Things like immunotherapies, targeted therapies, cellular therapies, we all have access. So everyone wants them. The cost is much less, but still, how are we going to keep that? Just to give an example, CAR T-cell therapy, it costs anything up to $600,000 in this country. Exactly the same treatment, I mean exactly the same. It costs $30,000. Okay, a bone marrow transplantation, above $500,000 in here. In our hospital, it is around 17 lakhs, which is $20,000. So as I said, 55% of these patients either do not pay. We have patient support programs. Through that, we try to manage all the bare minimum costs, and we have some government schemes. They pay very less. I'm sure this same story even in here. The insurance does not cover cancer all that well, because non-ending kind of expenses list, patients can go into multiple operations and they don't cover. So this is another problem. The data collection, the technology is coming to help us, especially in these areas. Definitely, we're looking very much forward to help us in reducing the cost in these areas. But there is already proven application at this time. For example, mammography is a very proven, and it proved to be much superior trained radiologist. Especially small lesions like this, as you see, could get missed. And these are very useful in our rural camps, where often very difficult to get a good radiologist to visit to the rural place. So this technology, it's a proven technology. Like that, X-rays are also being read by AI, which is proved to be more accurate. We're even doing a big program on pathology slides, where the AI identifies cancer cells much better, much faster. To read 150 slides, it takes a week of a really senior doctor's time, and it's done in less than 5 hours. The accuracy is much higher, and then the consistency is all through. There is no inter-observer variation. Two doctors reading the same slide could be given two different opinions. And there's another thing called intra-observers. If the same slide shown to me today, I give one diagnosis, 20 days later could be different. I may be upset, had an argument with my wife, and I could be talking about completely differently. The other thing is, as you if you read 50 slides in a day, the fag end of the day, you may not focus, but that's not going to happen with AI. Treatment planning, definitely all these machines are now incorporated. They come with AI incorporated. They adopt the treatment according to the patient's needs and even provide more personalized treatment. Just taking many patients' factors built into that and adjust, because this radiation, precision is extremely important, especially in brain tumors. You can't even afford to have 1 millimeter away from tumor, because such a critical brain tissue is there, and if this radiation goes and destroys that, the consequences are really bad, and therefore that's extremely important. Well, somebody talked about outcomes. Yes, AI will definitely give a lot more predictions, especially who is going to get complications, how to manage it well in advance. The last one, voice to text clinical summaries, is the one all our doctors like. It's hard for me to convince doctors to be really, AI compliant and put all the data in HIS, because as a surgeon, I know 40 years, I try to avoid that. I scribble a few things in the notes and give a prescription and go away rather than going and typing it. But somebody came up with this idea where as I talk to the patient and all the relevant information is sort of captured and documented. I love that. Everyone loves it. That's how we try to lure them into more compliance. Another important factor is, the virtual assistant. Vast majority of time, doctors spend more time in trying to speak to the patient's relatives, and then you explain to them half an hour, and then tomorrow, my uncle is in Los Angeles, he wants to know what. Again, you have to go on, tell them again. AAG hospitals in Hyderabad, they have already developed that it goes and picks up all the information any number of times, any time. It will explain to you everything in more comfortable way, in your own language, of course. And it also makes treatment schedules and medication reminders, symptom reporting, etc. Now, wearables are coming up. It will be very helpful when the patients go home. Many of these patients develop complications. It will warn them and sends the information to the hospital. That's a very useful thing. In my opinion, research in my hospital, I want them not to go for any innovation of new molecules. I want to find that 1/10 of the cost come down further. There is a scope, ladies and gentlemen. I tell you, HIV treatment in this country per year, per person costs $40,000. It's $200 in India, thanks to Ranbaxy, Reddy's Laboratories, etc. The new drugs, new regimes. And you may not agree with that. It costed $67 million, less than the cost of movie Gravity, to send interplanetary mission to Mars, Mangalyaan. It is possible. People are fully capable. So whatever that 1/10 cost, still I feel that it's very expensive. So our focus on our research is more to come out with new protocols, new regimes, rather than just importing what is designed in MD Anderson. This is what we tell all our people, our clinicians and our researchers, go and work towards it, find new. It may be 98.5% of what MD Anderson is, but it is 1/100th of a cost. That's exactly what we're looking at. So, does AI replace doctors? This is, a common question. AI does not replace doctors. It's a co-pilot. But I tell you, if you are not up to the AI, if you don't embrace AI, you'll be out. Time has already come. So, doctors better know that well at this time. In the ancient world, whoever was good in agriculture, they ruled the world, the Egyptians. And then a while later, whoever military might, for several centuries, strong, the Romans and so on, etc., they ruled the world for many, many centuries. And then came 18th and 19th century, whoever is power, industrial power, became dominant powers in the world. Now, no wonder, whoever is good at AI, this is what is going to rule, not just the medical field. the entire world. So there we are. But I want to just say this, all your technology will not be complete unless it's put to a compassionate for the benefit of mankind. So I know AI plays a greater role in medical side. I request all of you, my humble request is you have to keep that compassionate care. Look at that patient, he is at a terminal care, palliative care, comes to the end of the road situation, nothing, the best things in the world don't work for him, he is going to die. And our doctors have to treat him, and he is counting days, he knows he is going to die, his relatives know he is going to die, and our teams, caregiving teams, have to counsel him, deal with him. He is riddled with cancer all over the body, pain 24/7, can't eat, can't sleep. Sometimes, the bowel is obstructed and the passages go in the reverse direction. It's not an occasional thing, it is the kind of thing. You have to find all sorts of cocktails to make this patient comfortable, and that should be free. And many of them don't even pay for regular basic pain medication, forget about cancer medication. That's the kind of situation. That's what I call compassionate care. And ladies and gentlemen, I tell you there's tremendous joy in taking care of these patients. And working in that hospital, although I was an orthopedic surgeon, so fortunate, and I come and want to share this, this experience in the last 2 years. Thank you very much indeed for your kind attention.